Aaron to bring the greetings from the City Council. Councilman.
Thank you very much, Stephen. Thank you, Melissa. Good morning, everybody, and thanks so much for having me here today. I'd like to acknowledge my colleagues, Councilman Wilbur Jennings and Councilman Brian Principe, who represents this area. I'm encouraged to see 5 of Providence Housing Authority high-rise buildings join the ranks of nearly 250 public housing authorities across the country that have implemented smoke-free policies. Protecting our city's residents begins and ends in their homes. PHA is well on their way to protecting over 1,000 elderly and disabled residents from exposure to smoke, both first-hand and second-hand smoke in their homes. This policy does more than protect the health of residents, it also will help reduce the risk of fires. Smoking is the leading cause of residential fires and the #1 cause of fire death in the United States. So this new smoke-free policy is going to protect the residents of the buildings and preserve the property values, saving money on cleaning and repairs. I'd also like to commend the Providence Housing Authority, the Providence Community Health Center, for their involvement working to help people try to quit the Tobacco-Free Providence campaign. Earlier this year, I sponsored an ordinance that would put safeguards to ensure that our children don't get access to cigarettes. It was part of a larger effort to deal with smoking in the city, and it really demonstrates the City Council's commitment to improving the health, the quality, and the life of those in the city. And I'd like to thank my colleagues, Councilman Jennings and Principe, for their support on that ordinance. That's one of the steps that the council has been involved in to try to move things forward. And I urge people here, or anyone who wants to quit, to seek out the great team at the Providence Community Health Center. And I'll encourage you to try. We will get there. It is possible to do this. And congratulations to the PHA for the support of the initiative. And congratulations to the Tobacco-Free Providence campaign for their efforts to make Providence residents safe, healthy, and free from the harmful effects of tobacco. Thank you very much.
Very much, Councilman Gurdon. Right now, I'm happy to introduce to you our next speaker, Anna Noves, the Executive Director of Health, Division of Community, Family Health and Equity for the Rhode Island Department of Health. She leads the department's efforts to achieve the goal of health equity for all of Rhode Island. I had the pleasure and opportunity to meet and spend some time with Anna in Washington, D.C. last year at the Communities Putting Prevention to Work conference. Anna has worked in public health for almost 25 years, including 5 years in Cape Verde, 5 years in Portugal, and for the past 15 years here in the United States. Please welcome Anna Noves.
Thank you. Good morning, everyone. She just dated me, which is not a very good thing. But anyway, I am truly pleased to be here today and to bring greetings from the Department of Health on behalf of Dr. Fine, who could not be here today, and on behalf of our own division and the team that we have working on tobacco. When 2 years ago, almost now 2 years ago, we were on the planning stages of this application and this funding, and we worked with the City of Providence, some of these policies that we're putting on paper seem so hard and challenging to accomplish and to achieve. But it's not about telling people what to do. It's really creating an environment that sustains the healthy choices that everyone must make, and really sustaining and providing support for that healthy choice and for that decision that the individuals make. That is really what we have been trying to do. So on that sense, being a partner of the Providence Free Tobacco Campaign, it's really a thrill to see those 5 housing in Providence go smoke-free. At the same time, this would not be possible if we didn't have the support of all of the partners in this group, if we didn't have the support of the Providence Community Health Centers. And so it's great to see their leadership here because they can support that effort. If we didn't have the support of the city, and seeing the city here represented not only by the staff, but also by the city council and the implementation of local policies that also continue the effort from the state level. It's because we have all of this comprehensive approach, seeing the community-based organizations and the tobacco network that supports and creates the advocacy needed. So we can indeed talk about being smoke-free in the state. I can talk about data and tell you about the harmful effects of tobacco. We all know that, so it's not worth talking about it. I think what it's important to do today is truly celebrate your leadership in moving forward with these policy initiatives, that taking on the challenge of implementing something so difficult, but really not running away, as you said, but really embracing it and delivering at the end of the day. So thank you for doing that. Thank you to all of the partners. We really rely on all of you to be able to continue to make sure that the trends that we've seen in tobacco in this state continue to be a reality. And they only can continue to be a reality if we all continue to work together. So thank you.
Thank you very much, Anna. Our next speaker today is the lovely Mary Jean Francis, who has worked for the Providence Community Health Center for 30 years in various capacities. I also had the pleasure to spend some time with Mary Jean at the Communities Putting Prevention to Work conference also. Her input and expertise with the smoking cessation program was vital to our success. Currently, she is the Vice President of Performance Improvement and oversees the development and implementation of the Providence Community Health Center's healthcare plan, which does include tobacco treatment program. Please welcome Mary Jean Francis.
Specialist and a trilingual tobacco treatment associate, Sabrina Saws, and I would like to thank them for their good work and their passion in going around city sites, the beautiful city sites, and meeting with the residents on their terms, breaking down barriers in transportation and language and finances, so that we can, along with the city and the Department of Health, and under the leadership of Mr. O'Rourke and Melissa, to continue to try to make Providence smoke-free and healthy. Thank you.
Thank you very much, Mary Jean. Last but not at all least is J.T. Taylor, the president of the Hartford Park Resident Association since 2002. Resident Advisory Board President and long-standing Commissioner for the Providence Housing Authority. She is also a resident member of the PHA Smoke-Free Task Force. JT is a very energetic leader and force within her community and always has the best interest of public housing residents, which always crosses development lines. She is here to say a few important words. Come up, JT.
My name is J.T. When I started smoking cigarettes, it was 25 cents a pack. Now they're 8.10. Somebody made money, it wasn't me. When the smoke-free policy was run into the board last September, I voted against it. I voted against it for two reasons. One, I needed my residents to explain to me what they thought about the policy. I don't like to put things in front of people and say you have to do it. I brought this situation and this matter up in 2 meetings, and I was very surprised to hear my residents was very happy that there will be no smoke in the building. In fact, 75% of the people wants a smoke-free building. I joined the smoke-free task force because of the process I once voted against. The reason I really want to stop smoking is because of my granddaughter, which is an adopted child to me. She told me, JT, I need to speak to you. And I said, what is it, child? And she said, I lost my papi, I lost my grandpa, I lost my uncle. I don't want to lose you. That was a slap of reality to me. So now I am on the board to quit smoking. Finally, I have to tell you all, if it wasn't for PHA, this program would not get off the ground. And so everybody should be happy with PHA. Also, I would like to thank you all for being here.
Before we end today, I did not plan to say this, but I really did want to. I know we mentioned Dolores Casella, who's a resident now involved in smoking cessation services, and JT also. But there's a PHA employee here also. Her name is Liz Perrault. She's in the back. And I want to thank you for your presence today and your dedication to quit smoking also, because you're setting an example not only in your building but to the other employees of the Providence Housing Authority. Thank you very, very much for coming today. I really appreciate this.
And just last but not least, we have to inform you that because of the success of today, you cannot light up a celebratory cigar. Thank you for coming.